Hello viewers, my name is Dr. Nseka Akinyuku. I'm a fertility consultant. Today we're going to be talking about why IVF fails and what we can do about it. In vitro fertilization is a form of assisted reproductive technology that involves the handling of the male garment, which is the sperm, and the female garment, which is the egg, outside the body to form a baby. The baby is transferred back into the mother and pregnancy ensues. In vitro fertilization can take as long as weeks or months and is indicated by male and female factors and sometimes a combination of both factors. In vitro fertilization is very challenging. And the challenges include high expectation by the couple, the cost, the emotional stress, depression, marital problems, and the time spent by the couple in achieving this pregnancy. The success rate is dependent on a lot of factors, and age is one of those very important factors. Above the age of 40, success rate is about 10%. Below the age of 30, the success rate is about 40 to 60%. For this reason, it's very important we discuss this topic so that we can all be informed and better equipped to prevent this failure. So the problem of IVF failure could be as a result of the problems with the embryo or problems with the endometrium. The embryo is the mini baby. It is the product of the fertilization of the egg and the embryo. A good embryo results in pregnancy. A bad one results in a failed IVF. Bad embryos are formed from bad eggs and bad sperm, or bad egg or bad sperm, or both. And the reasons why a male could have a bad sperm could be advanced male age, above 50 years, smoking, alcoholism, medical disorders like diabetes, low sperm count, DNA fragmentation. For the female, advanced age, those above 40 years are at risk of having poor quality and quantity of eggs. Medical disorders like diabetes, like hyperthyroidism, like hyperprolactinemia, and if they are overweight, if their BMI is above 30, it's also a risk factor for failure. There's also the problem of the uterus. The uterus is the house where the embryo is housed. And so if there are congenital malformations, like the woman is born without a womb, for example, or there are septations in the womb, divisions in the womb, problems that she's born with the womb, that could lead to failure as well. Uterine fibroids, adenomyosis, adhesions, infections of the womb, hydrosalpinx, endometriosis, and also if the endometrium during the period of IVF refuses to thicken to 8 millimeters and above, then we could have a problem with that IVF process. There are patient-related factors. Remember that the patient and the fertility experts have to work hand in hand to ensure success. So if the patient still maintains the lifestyle we've been talking about, we say stop smoking, stop drinking, stop taking hard drugs, rest, sleep, and the rest, observe a good diet, do exercises, that could impact on the success of IVF. Patient anxiety is also a problem. Patient should be calm. Anxiety affects the hormones of a woman. Impatient patient, the patient could be so impatient that she pushes for things that have not gotten to the time in which they are supposed to be done, and that could also affect our success rate. Patient not taking our medications correctly, these drugs we give are hormonal, so they have a particular cyclical form. So if you are told to take your drug at a particular time every day, maintain that timing. Patient missing appointment schedules, that is a worrying problem. We call a patient come for scan or come for a test or the other. Those tests are timed. If she misses that day or that time, it affects the whole process as a whole. Then patient taking drugs over the counter, taking non-prescribed drugs, taking herbs and the rest. Those drugs affect our drugs and really affect the success of IVF. Then patients that are overweight need to carry out exercise and observe a good diet. Also, if patients delay testing, if patients delay their treatment, if they don't take a professional advice, if they insist on carrying out a procedure when it's not the time for that procedure, it impacts on the success rate. There are hospital-based factors also. Citing an IVF center in a noisy, dusty environment is not a good idea. Also, the personnel carrying out their procedures in an aseptic manner, in a dirty manner, also affects the success of IVF. If the infrastructure is inadequate, if the equipments are not working well, if the skill of the practitioner is not optimal, if the practitioner does not know is not updated on the current trends of management of IVF patients, then there could be problems with failure as well. Then how do we prevent this IVF failure? That is the meat of the matter. Sometimes the IVF failure prevention could be after an already existing failure. That is a previous failure. Now we are now trying to prevent it from happening again. So for the male, the male will be encouraged to do a seminal fluid analysis test, which is the sperm test, which is easy to perform. The man does not pass through any pain to get the sperm out. But a lot of men, because of ego, because of shyness, because of pride, they may not want to give their sperm. They may feel that they are very sufficient, but it doesn't show on the body. It's important you do your test and you are sure that you don't have a problem. Or if you have a problem that's amenable to treatment, you are treated adequately and promptly. They should take their medications promptly if they have to be given medications, and then they should change their lifestyle. Smoking, alcoholism, and the need for exercise is also there. They should also treat any medical conditions that is identified in them, like diabetes, like sexually transmitted disease, and they should follow doctor's advice. For the females, we expect the female to be patient. We know the weight, the burden of infertility is on the female because of what the societal pressure placed on women for fertility. But we also advise them that she should comply with our directives. If we ask them to come for ultrasound, they should keep the ultrasound schedules. The drugs that are prescribed at times, because they're hormonal drugs, they follow a cycle. So if you are asked to take your drug at a particular time, maintain that particular timing. Your lifestyle needs also to change. Same issues of smoking, alcohol, and exercise and diet is also there. And then we should also treat medical conditions like we mentioned for the men appropriately and promptly, and they should follow doctor's advice. Now, when this IVF has failed, before we now start looking for a way forward, what do we do? As professionals, we know that it is a very emotional and psychologically burdening condition to have a failed IVF with all the expectations that have already been placed on the couple and all the time and expenses they've put into the process. So we break the news empathetically and we allow the patient to grieve. We try to explain what the causes of the IVF could have been. We follow up these patients. We give them a separate appointment to discuss the future plans. Some may be so depressed that they don't want to have anything to do with having children anymore. You have to encourage them. And so, if there are conditions that we identify that could have led to these failures that were not properly managed, like diabetes, like hyperthyroidism, like hyperprolactinemia, like the weight of the patient, we handle it in this period before the next attempt at IVF. Then surgeries could be performed like myomectomy, like uterine adhesiolysis, hysteroscopy, laparoscopy, and for the men, testicular sperm aspiration, TISA. Yes. Now, if the couple has decided that they want to try again, they need to wait for a month or two. It's very important so that all the hormones that have been built up within them will come back to normal. The body will come back to its normal physiology and anatomy, so that when we now start a new cycle, we're starting on a good baseline state. And so one of the things we could change is that we could change the stimulation protocol, we could change the dose of the drug, we could also change the drug itself to achieve success. We could do anything. We can do a lot of things to make sure that we achieve a successful pregnancy. For the men, we could this time try intracytoplasmic sperm injection, especially if the man has a low sperm count. Then we could advise the couple to go for a donor egg or donor sperm if we notice that the problem could be coming from there, or a donor embryo. For those who we've noticed that probably the problem could be from the womb, then we can talk about using a surrogate. That is another lady carrying the pregnancy for the couple. Then finally, after all done and no success, then we can now advise that they may need to adopt a baby. So adoption is the final solution to having a child if all things fail. So in conclusion, I would just like to say that IVF is a very important fertility treatment. It is expensive, though it has a low success rate, but advanced maternal age is actually a major cause of failure. IVF failure could be prevented in some cases, but in some cases it may not be prevented. If IVF failure most times can only be prevented in the next cycle after the previous cycle has already failed. And the aim of the fertility experts, the aim of the patient, the aim of the couple, the aim of the whole team is to ensure a woman gets pregnant. So the aim of this presentation is to assist you get pregnant. Thank you very much for your time. God bless you.